Hello, my name is Einar Jordan, and I work as a biotech engineer. I'm also been working towards healing multiple autoimmune diseases myself. So these are videos listing the results of my experiments. This is not a recommendation. This is just documentation of what I'm doing. I am also not a doctor, nor a nutritionist, or also a compound pharmacist. So as I posted on my earliest video, all of the treatments that I have used to grow a lot of my hair back, I was using Minoxidil topical, and previous to that I did a carnivore diet or a low carb diet and a fecal matter transplant, and that's helped grow a lot of my hair. And then I came across some new research that was published talking about taking Minoxidil. So Minoxidil is a blood pressure medication that's been around for a very long time, and it was noticed recently or multiple times that people were growing hair everywhere more than normal. However, the dose for the medication is very high, so you might not want to take a high dose. That what most people do, and what the experiments have shown, is somewhere between 0.5 milligram to 1 milligram is the optimal dose for hair growth. And since this is a prescription medication, it's hard for people to get it. So you have to get a capsule and then cut it in pieces. And at this time, I'm not able to get a prescription for that. So since I have worked for pharmaceuticals for a very long time, I started looking at the ingredients, and the ingredients are basically the same. However, the concentration of topical Minoxidil is very high. So I would not recommend, I wouldn't take myself drops of it, because a drop is going to have, a drop is about 200 milliliters. And each drop, I think the math is about 10 grams what you're really taking, which is already a high dose as it is. You want to, and I'm trying to do 0.5 to 1 milligram. So I did the math again, and I'm lucky that I keep some instruments in the house. So I have a pipette, and I set it to 10 microliters, which is about 0.5 milligram. Now, unless you know how to use a pipette, I would not recommend you do this at home, because it's kind of tricky. It seems like a simple thing, you push, but there is multiple settings, and I'll try to demonstrate. If you actually set it to 10 microliters and you push all the way to the bottom, you're gonna pick up, you see, a very large volume. As you can see, that is the full size of the pipette, which is about 1,000 microliters, which will be 50 milligrams. Your heart is gonna go a little crazy. And I tested 20 microliters and so on, and yeah, your heart rate increases significantly. So the way to know and to experiment with this is to push it all the way to the bottom. See how much you pick up once you have it set at 10 microliters, or just touch it mildly and see how much you pick up. And you see the difference which is very, very little. Now you can put this on water and take it, or I'm lucky that I have some capsules in-house. Whoopsie. Some capsules in-house, extra capsules, gelatin. These ones break on the gut, not the colon. So again, this is also tricky. Don't be doing this at home, kids. So I put in the capsule. That's about a tiny little drop. Then close it and take it. You don't have to do this. You can just put it in water or just put it in your tongue. As long as it's 0.5 microliter. If you're going higher than that, you are not gonna have a good time. It's gonna take at least a day. Only if you have a serious condition, this could put your foot on the other side and you might not come back. So this is dangerous. Consult your physician, get a prescription, explain to them that the clinical trials are going on and the results are such, and he might be able to prescribe it off the label. You can cut it in small pieces, and take it. I normally take 0.5 milligram in the morning, 0.5 milligram in the afternoon. That makes a full milligram. And it seems to be working, but it's still too early. So the difference between topical and oral is almost about 100%. Not meaning that you're gonna get all your hair back, but it's just double. So if our hair grows back by 20%, oral could grow by 40% back. At least on the trials, they did it for 24 weeks. I'm on week 2, so it's still too early to tell. And I will update with a new video as soon as I can show some results. They might be on myself, no results, since I've done so many different things. This could just be, nothing new. I still do the topical with the needles, with the micro needle. I just rub it around and twice a day, just in case, don't help. Well, be nice to have my hair back, not the end of the world. Have a great day. Please subscribe to my channel, and I will continue to update with my experiments and hopefully help you biohack a lot of your health back.